Hi there, welcome to a presentation from CBH Education. The purpose of these presentations are short snippets of drugs and the mechanism of action, core side effects. Today we're going to be covering aldosterone antagonists. So what are aldosterone antagonists? Well, aldosterone antagonists actually inhibit aldosterone by binding to the aldosterone receptor, and this increases the sodium and water excretion and potassium retention. Some of the clinical indications you may find in clinical practice include cirrhosis, chronic heart failure, and primary hyperaldosteronism. Side effects are quite typical: hyperkalemia, gynecomastia, especially with spironolactone, liver impairment, jaundice, and Stevens-Johnson syndromes. Drug interactions tend to be with the ACE inhibitors and the ARBs, although you tend to monitor these with the UNEs. Counterindications include renal impairment, hyperkalemia, and Addison's disease. And one of the key monitoring parameters is the serum potassium concentration. So as mentioned before, it's really essential that you do monitor the UNEs. When we're looking at things in terms of ward rounds, we're looking at things from a revision perspective, especially for the pharmacy pre-registration exam. From a clinical perspective, some of the key words that you may come across is like the mineral corticoids, for instance. Automatically, you should be thinking about, right, aldosterone antagonist, spironolactone, hyperkalemia. So if somebody has a clinical presentation of hyperkalemia, you've got to think what kind of therapy they're on. This kind of includes aspects such as spironolactone, and then obviously you'd look for other similar drugs as well, such as the loop diuretics. Renal function is something essential. So obviously for the GPHC exam or for your university exam, they may bring out a chart and what do you have to analyze on here. And when you see kind of elevated potassium, automatically that will then direct you towards drugs such as spironolactone. And then heart failure and cirrhosis. So when you're looking at a drug chart or when you're looking at things from a clinical perspective, these are the two conditions that you may think, right, spironolactone is used here. Okay, so we'll be doing further lectures around drugs, really short ones, just to help you with your revision, and any kind of aspect where we see things covered in exams, we'll bring this up as well. Thank you for listening.